Our world has changed. The places meant for people are now mostly empty. The tourist sites we flock to across Canada and all over the world to laugh and love and live are almost deserted. No one is immune. Who could have imagined this, that the fight against a virus, an invisible enemy, would turn into a worldwide war? The scale of what happens next in this pandemic depends on what each of us does individually, because we're all in this together. Good evening and thanks for joining us. We know there's anxiety and uncertainty and a sense of foreboding right now. We all feel it. We're in the midst of a pandemic. I've always believed knowledge is power, and the more you know, the less you fear. And so tonight, we're going to try to inform you, bring you the facts, tell you how people are coping, including a colleague at Global News who has COVID-19, and what public health experts are saying. First, though, a look at the numbers that everyone is watching. There are 24 deaths and more than 2,000 cases in Canada now. That number has doubled in 3 days. BC, Ontario, Alberta, and Quebec are by far the hardest hit. They account for more than 90% of all cases in Canada now. Every province and territory except Nunavut has detected the virus. The response is ramping up as the numbers ramp up. The Prime Minister is poised to introduce new legislation that would give the government sweeping powers to spend money and raise taxes without needing the approval of Parliament. And Justin Trudeau issued a new stern warning to Canadians today. Ignoring advice, hanging out on beaches and in parks and socializing. Tougher measures, he says, could be coming.
Enough is enough. Go home and stay home. This is what we all need to be doing. And we're going to make sure this happens, whether by educating people more on the risks or by enforcing the rules, if that's needed.
The Federal Health Minister, Patty Hajdu, joins me now. Minister, there's lots of concern about people not heeding the polite advice to keep contact to a minimum, to keep physically distant from each other, and to self-isolate if we come back from travel. Isn't it time to get much tougher?
I think I've made that clear in my comments over the past few days that, as jurisdictions are taking more and more stringent measures to remind Canadians of the need to stay home, that people can expect that that there will be tougher consequences. And I think in particular, when you are, coming back, for example, from your March break or snowbirds that are returning to the country, people have to listen to the guidance of public health. This is very serious, and we want to make sure that Canadians have obviously the best possible ability to stay healthy and to not endanger the lives of other people.
But we know that some people are not listening.
Well, that absolutely, and just as I said before, what we really want Canadians to do is realize this is a time that can be very dangerous for people in our communities, not just the people that we've been talking about who are most at risk, of course, those who are most vulnerable. We have to act as if each one of us is carrying the virus and take appropriate precautions. And those are things like if you are sick, that you are not going outside of your house, that you are not stopping outside to visit your neighbors, on your way home. This is a serious public health emergency, not just in Canada, but all around the world.
China started lockdowns at 30 deaths. Italy started lockdowns at 800 deaths. We know that time lost means lives lost. So what are you waiting for to lock down the country?
We have various forms of lockdowns, quite frankly. We have the closure of pubs and restaurants and retail stores, non-essential services in various different parts of the country. We have, at the local level, even more severe restrictions. We have a number of measures that are happening at the federal level around the transportation, for example. These are forms of lockdowns. In fact, the fact that we have no international travel pretty much anywhere around the globe, one could say, is a travel lockdown. So I think we have to be careful about what we're talking about. But what we could see, happening is that with the epidemiology of this disease, if we have specific outbreaks in parts of the country, more stringent measures to make sure that we don't see a wider spread of the illness throughout the country.
Your own estimate is that 30 to 70% of Canadians will get this virus, and that 5% will need ventilators. If you take the low end of that, that means about 11 million Canadians will get the virus and about 500,000 will need ventilators. Are we anywhere close to ready for that?
Listen, if it all happened at once, absolutely not. And that's the reason why we need to flatten the curve, because there's no capacity in our public health system to deal with that many critically ill people at once. And that is the important work that we're doing together. That's the point behind flattening the curve. It's to make sure that we don't see a surge in illness that our healthcare system just simply can't manage. On the flip side, obviously, we're working extremely hard to procure additional measures to support Canadians no matter where they live, whether it's having a federal capacity to procure more ventilators to backfill the provinces and territories' current supply. I know provinces and territories are working to clear out hospitals and make sure they have critical care capacity and that they have non-essential care sort of cleared out of their hospitals to get ready for that onslaught. But listen, that's the point behind flattening the curve, and that's why it's so important that people listen to the measures that politicians and leaders are saying are absolutely essential right now.
The government's working hard to get stranded Canadians home. What's going to happen to those people and the people who are flying in from places like New York City, which is a hot zone right now? Are we counting on them to be good citizens and self-isolate, or should they be quarantined?
I certainly do have the powers within the Quarantine Act to take stronger measures, and we're considering all measures right now in terms of returning passengers. In the interim, I would advise all Canadians strongly that they must stay at home when they are returning from international travels, and that obviously if they are feeling ill, they need to present themselves to public health and call ahead.
What's the most critical thing for Canada right now? What's keeping you awake at night?
Well, I think it's both those questions. One is, how do we protect lives and keep Canadians as healthy as possible in this extremely difficult and dangerous time in terms of this pandemic? And the second question that keeps me awake is, how do we get out of this? And so I can tell you that we're working on both of those questions, as I said, flat out. And I want to thank all the civil servants who are literally working around the clock on many, many aspects of this. I know no matter which department you're talking about, there are people working to solve for all of the many problems that interconnect with a global pandemic of this size.
Patty Hajdu, the Federal Health Minister, thank you.
Thank you very much for the questions.
I'm in North Vancouver right now on a balcony not far from my home, but away from the public and with just a tiny crew. We're all keeping our distance from each other. Not far from here is where the first outbreak happened in Canada and where the first Canadian death of COVID-19 was recorded. The Lynn Valley Care Centre is about 12 kilometres from downtown Vancouver. A healthcare worker in her 50s with no recent travel history was the first to test positive there. It's what BC health officials had been dreading, the first case of community transmission. The virus has since spread to at least 36 residents of the care home and 19 staff members. 10 residents have died. About 2/3 of the people who live there have some level of dementia. Many need 24-hour care. That's heartbreaking enough. Adding an invisible, deadly virus has taken heartbreak to the next level. Sarah McDonald spoke with some of the families about what they're enduring.
The pandemic sweeping the globe has grabbed a foothold where Canadian seniors are supposed to be safest. The rapidly spreading, highly contagious coronavirus seeping into long-term care homes across the country.
Look at your mother's hair and her beautiful outfit. She was so styling.
Claiming vulnerable, though valued, members of society like Sandra Cairns.
If she was able to say anything now from heaven, she would say, use my face, tell the world, so that people are more careful.
In life, an accomplished career nurse.
Unfortunately and sadly, one additional death to report.
Becoming yet another statistic in death.
They said another person died at the Lynn Valley Centre, and I'm kind of like, well, that was my mom.
This is the epicenter so far in the country's COVID-19 crisis. Long-term care homes from BC to Quebec scrambling to contain its spread. The consequences of this virus running rampant in similar settings are impossible to ignore south of the border, where dozens have already died in Washington state.
When I fall in love,
leaving loved ones divided by walls.
Or I'll never fall in love.
and spouses separated by glass in nearly every state.
Could you read my sign? Could you read my sign?
In our own country, new measures are now in place at many care homes to curb COVID-19, with government urging physical distance between young and old Canadians.
You're not just putting yourself at risk, you're putting others at risk too. Your elderly relative who's in a senior's home.
If you're not doing it for yourself, do it for your family.
As grown sons and daughters like Deborah Drew join healthcare workers in the fight behind now fortified walls.
These people cannot be forgotten. They need to have this time to be treated with dignity.
Her father, a veteran, recently testing positive for the disease, waging a whole new war on the world. Sarah McDonald, Global News.
Still ahead, despite an Olympic-sized disappointment, a unifying message from one of Canada's top athletes. Also tonight, on the front lines, nurses, doctors saving lives and facing a new and deadly foe. And after the break, a member of the Global News family diagnosed with COVID-19, a first-hand account of living with the virus. That's next. Welcome back. Well, we've all had to adapt how we live and work. I'm no longer in the studio, for example. I'm now on a balcony in North Vancouver. My colleague at Global News in Toronto, Farah Nasser, has been broadcasting from her home while she's in self-isolation. And Farah joins me from there now. Farah.
Thanks so much, Dawna. Yeah, the crisis has hit us all in very personal ways. And while there are more than 1,000 cases of COVID-19 in Canada, earlier this month, we learned that a member of our Global News team here in Toronto had tested positive.
After a cloudy day, the sun is shining once again on the city of Toronto. It's actually
Global News' chief meteorologist Anthony Farnell tested positive for COVID-19 on March 13th. Anthony Farnell joins me now. And first, Anthony, we are so thankful and so happy that you are doing well now and that you've recovered from your symptoms. But I want to go back in time. So first, where and when do you think you first contracted the virus?
Well, I don't know exactly, but I was on a ski trip in Austria and we got back March 1st and I wasn't sick initially. I actually flew home through Switzerland, through London, and then back into Toronto. So I don't know exactly where I picked it up, but there were people from all over Europe, all over the world really, at this ski resort in Austria. And it really was a melting pot, I think, for this COVID-19 virus. So I'm thinking I got it there, and then I came back to Toronto, and within a couple of days of work, I started to feel ill, and I actually took 2 days off, but the symptoms went away. I got better later that week.
What were those initial symptoms, though?
Well, I had definitely body aches. That was something that I initially thought was because I skied 6 days in a row, and it's something I've never done before, so my body was just tired to begin with. But then it came with a fever, and all of that went away. But it came back a couple of days later, and that's when I started to really think that something was up. And I also lost my smell, I lost my taste, I started to get shortness of breath, and some of those are the symptoms that you're supposed to look out for, and that's when I went in and got tested.
Yeah, so what exactly did you do? You got tested, did you contact public health? How did that all work with work?
Well, we have to remember how fast things change with this virus. So we're going back almost 2 weeks ago, and it wasn't easy at the time to get tested. I know for many it still isn't, but I called my doctor. I didn't go in there. I didn't show up. I didn't want to infect anybody. He told me that the likelihood of me getting it from Austria was very slim. Same thing with Toronto Public Health. They said there's no point in coming in and getting tested. I went in anyways. I went to the emergency room and put on a mask, and they escorted me right away to my own room, and I got the test done, which is a little bit uncomfortable at the time. And then 2 days later, I found out that I did test positive for COVID-19.
And then you self-isolated. You didn't come back to work.
That's right. So unfortunately, I did work a few days. That first week I got back. I came back the next week for 1 day. But once I got sick again, I took off and I started isolating right away. So that was the steps that I had read about, I learned to do. And then, of course, once you get the test, the doctors help you out. They tell you exactly what to do and who not to see. You're supposed to isolate at home. And that's where I've been pretty much since, as I daily talk to Toronto Public Health. They check in on you, make sure you're doing okay, and I haven't had symptoms now for almost 10 days.
And I know Public Health also contacted the people that you were in contact with when you were at work or wherever you were. I want to know your key message right now, given what you've gone through, to Canadians.
Well, you know, I was one of the early cases in Canada, so I guess a bit of a guinea pig, and it is, from what I've heard, very different. So there are severe cases, obviously, and a lot of that has to do with age. Myself, young, relatively fit. It was mild. There was fever, there was coughing, and I think I got off pretty easy. But now I just know that a lot of people are scared of getting it, of contacting it, and then also obviously spreading it to their loved ones, and especially the elderly. So self-isolation, it's the easiest method to control this, and that's something that I think we all have to do, whether you have symptoms like I did or whether you're completely healthy, or at least you think you are. So we're just going to have to do this all together as Canadians, and thankfully I'm better now, and I'm excited to get back out there to work.
All right, we'll end it there. Thanks so much for that, Anthony. I'm glad that we're still able to work during this, and it's great to see you.
Thanks, Farah.
For everybody. And
still ahead, March break is over, real life is setting in, and Canadian families are adjusting on the fly. I'll have that part of the story coming up. Back to you, Dawna.
All right, thanks. You know, a big part of preparing for this pandemic is ensuring frontline workers have what they need to treat patients and protect themselves at the same time from getting sick. The federal government says it's working to make sure that hospitals are ready for the expected surge, but some frontline workers say they're worried not enough is being done. You only have to look as far as Italy to see how quickly a modern healthcare system can be completely overwhelmed by COVID-19. That country saw such an aggressive spike in cases, hospitals ran out of ventilators. And without enough protective gear to go around, thousands of healthcare workers have become sick themselves. What is unfolding in Italy and now in Spain and elsewhere is almost beyond belief, and it's a lesson for other countries to act fast or face deadly consequences. Here in Canada, we're told to keep our distance from others and stay home. If you don't, you risk spreading the virus, making others sick and overwhelming the hospitals. Healthcare workers across this country are bracing for that. One Toronto hospital is doing everything it can to prepare, and tonight we take you inside the Humber River Hospital, preparing for war with an invisible enemy.
I can tell you that our hospital and every hospital is doing everything it can to prepare for that surge. It's all hands on deck. Everybody's rolling up their sleeves. My name is Dr. Taslim Nimji, and I'm an ER physician and the Director of Medical Innovation for Humber River Hospital. So when I'm doing my administrative job, I'm helping the hospital in its preparedness for pandemic planning. That's us looking at how do we ensure that we have enough healthcare workers on the job to treat our patients. That's how do we make sure that we have enough equipment. You've heard a lot about ventilators, for example. How do we make sure we have enough beds and space to treat patients? Every patient that walks in is a patient, is a human being on that other side, and we can't forget that in this crisis. 003. We have processes, triaging processes, where we ask screening questions to try to determine whether somebody is a suspected or a positive case for COVID-19. We are still seeing people that are coming in, anxieties run high, wondering if they have COVID-19, wondering if they meet screening criteria. We are seeing patients that are positive for COVID-19 already, known positive cases. This is a real concern. The amount of personal protective equipment, there isn't a hospital in the province, in the country, that isn't concerned about having enough personal protective equipment to be able to take us through what we're about to experience.
With the 9105 small, okay.
So this means donning, what we call donning personal protective equipment, and this means putting on the appropriate clothing, right? And it's not clothing, it's surgical masks, it's gloves, it's gowns, so that when you're treating that patient, you're then only wearing that equipment to protect yourself, and then doffing, what we call taking off that equipment in a very specific order so that you don't contaminate yourself when you exit that room.
Ticket R 004.
We've talked about flattening the curve and trying to decrease that burden and pressure on the healthcare system. We're still seeing cases increase higher in number daily than we would want. I do think that when you look at other countries comparatively, we may have started pushing the message of social distancing earlier, but there are many of us that are wondering if we need to be more aggressive about that at this point.
Concerns, anything that's related to COVID?
As we're here putting ourselves in harm's way for our patients, which we are happy and proud to do, but as we sit here and come here every day and work tirelessly long hours, and our families help support us to do so, we need the community to do its part. People are going to be hospitalized, and far worse, people are going to die. And we've seen that across the globe. This is not something that's hitting us that we don't know about. We know what the ramifications are here. But if we're not aggressively implementing social distancing measures, then that's going to be a problem. That is going to be a problem for every hospital in the country.
With me now is Dr. Michael Gardam. He's Chief of Staff at Humber River Hospital. Dr. Gardam, all of us are so overwhelmingly grateful for all the frontline staff in hospitals and clinics across the country who are facing what we're all facing, but theirs is such an intimate and deeply personal risk. What are your staff at the hospital telling you about their concerns and what their fears are?
Yeah, certainly people are very worried right now. They have a number of worries. They worry about, will we have enough personal protective equipment for all of us? What do we do if we get into difficult situations like what's happened in Italy, where we have to make almost impossible choices over, who gets access to certain medical care and who doesn't. They worry about their families. I get questions like, am I going to be bringing this home on my shoes? Do I need to leave my shoes outside? So, for most people, this is a weird time, but for those of us in healthcare, it really is nonstop, every day, all day.
Do you have answers for them?
Well, a lot of this stuff comes down to fairly common sense. I mean, if you think, for example, people worried about their clothing. I mean, what we've done in the hospital is suggested that people, don't wear suits to work. Wear clothing that you can easily wash when you get home. In terms of worrying about your shoes having this, really, if you're going to get infected with this virus, it's really in this area here. So make sure that your hands are washed and clean. If you have to take your shoes off, things like that we can give advice on. Things like the personal protective equipment is a really challenging one, because obviously everybody's looking for it right now and it's very hard to get supply. And so there's a lot of discussion going on right now about how do we conserve the amount that we have for when we get that wave coming in a few weeks. And there's also talk even about whether there's opportunities to potentially try to reuse equipment that we've already used. It's not something we would normally do, but desperate times call for desperate measures.
You know that lost time means lost lives, and it's so clear when we look at Italy what can happen when the system is overwhelmed. Can what happened in Italy happen here?
Yeah, absolutely. What happened in Italy could happen here. I think that every week that goes by, I feel a little bit more comfortable that we're likely not going to get into an Italy situation. That doesn't mean we're not going to be overwhelmed. It's just may mean more that we're overwhelmed a little bit less than what's happening in Italy. I take some comfort from other countries that have been able to control this without getting into that situation. And that's why, we need to be so aggressive with the public health measures that we're taking right now in terms of social distancing. That's really about preventing cases from spreading, who then end up in our emergency departments and end up in our ICUs.
All right, Dr. Michael Gardam, thank you.
Thanks for having me.
Still ahead, is there a magic bullet drug treatment on the way? And what's the prognosis for the planet? I talked to a Canadian doctor with the World Health Organization. And small business, big problems, the cash crunch of a new reality. We know so many of you have lost your jobs or are afraid of losing your jobs or at risk of losing your business. It's a scenario playing out across the country. From hair salons to convenience stores to diners, this virus is killing business. Global's Jeff Semple has some personal stories about what that means.
In 25 years, Giovanni Mascia's family and his customers say they can't remember him ever taking a day off.
They're every morning preparing the foods, gets the groceries.
Their father still comes in, makes the dough every morning.
I work every day, 7-day week, no day off. We do everything fresh. That's the most important thing. I love work. I love to do what I do.
Mascia moved to Canada from Italy in 1968 and opened this Italian restaurant in the heart of Niagara Falls. They had 4 children, and as their family grew, so too did the business.
The business has grown over the years, but they all work here every day.
During the busy summer months, the restaurant now employs 150 people. Customers line up down the street for a taste of homemade Italian cuisine.
Oh my God.
Oh, come on. There's that wood oven pizza is like bar none. And this is the crazy part. This is no cliche. I can tell you that the pizza tastes the same today as it did in '92 when they started coming here.
Like we're jonesing for the pizza right now. We're having a hard time.
It's a huge restaurant in the community, not only for what they do outside, like supporting teams and supporting local charities, but it also brings in a lot of locals that this is where they come for their Friday night dinners.
But not anymore. This is what Niagara Falls would typically look like this time of year, crowds clamoring for a glimpse of one of the 7 wonders of the world. But this is that picture postcard today. The crowds and the customers gone.
Right now, it's just a ghost town. It's really sad to see.
Have you ever seen this city like this?
No. Not like that. No.
For businesses like theirs, the trouble is double. The U.S. border nearby now closed to all non-essential travel. The tourism industry in Niagara Falls employs more than 40,000 people. That's half the city's population.
We do rely on the Americans, of course, to help support Niagara Falls.
Last week, for the first time in its history, Mascia's restaurant closed indefinitely. Its 80 employees laid off, including Brianna Grondin.
You don't know how long it's going to last because May then brings into June, and June starts the full summer season here.
But even with his restaurant closed, Mascia still arrives here every morning. He worries for his family here and back home in Italy. But he's asking his community to hold on to hope.
Can't do much. Hope, like I say, hope.
And Sunday night, the city responded. Niagara Falls' famous skyline lit up with hearts and a message of hope. Hotels here are now offering free lodging to any healthcare workers. And when the storm is over, this restaurant plans to host one heck of a party. Jeff Semple, Global News, Niagara Falls.
The impact of this pandemic is being seen and felt right across the country, from closed down businesses to quiet streets and empty trains and buses. This, for example, was the Montreal subway this morning at 8 a.m. On a normal day, it would be packed shoulder to shoulder. Today, far from it. Ridership is down 75%. Just like every city, town, and village in this country, people are being told to stay home unless their job is deemed to be essential. Those who can work from home are working from home. Farah Nasser has that part of the story and all that it entails. Farah?
Thanks, Dawna. As you may know, I have been in self-isolation for the past 14 days with my family after we recently returned from a trip. And according to the Canada Border Services Agency, close to 1 million Canadians have traveled home back to Canada since March 13th. So whether you are socially, for physically distancing, or in self-isolation like me, life for sure has changed drastically. With kids at home and no school, Canadians are getting creative, trying to figure out how to work from home, fight boredom, and pass the time. With so many Canadians doing the same thing, we wanted to share how people are coping, including some of the Toronto Raptors.
Guess where I am?
at home. And please, if you don't work for an essential service, that's where you should be too.
Hi, my name is Anami. I live in Mississauga and I've been home for 9 days. What I've been doing is I've tried to get some homework done on my portable desk made entirely out of cardboard and half a noodle.
Rachel, what did you do yesterday?
I cut my own hair.
You did what?
Cut my own hair.
What's up, Doc? Yo, you must be bored.
Bro, you know I am.
You done called me 6 out of 7 days, bro. All the monkeys on the kangaroo, dance to the alligator.
Quarantine day number 3.
Quarantine day 9:50.
Quarantine day 8,000.
So, 3 kids in a house. We have a couple rules. One is 30 minutes of cardio a day. That goes for everybody, and that's for our mood. We have meals together.
Meanwhile, the dog is taking over the fort.
I missed all my friends, and everyone misses all their friends because they didn't realize the good aspect of school until it was gone. Like, everyone was so excited for school to be over. Like, that we had like a really long lunch break, but now no one wants to do it anymore. Eating these chicken tacos, and she already finished. She's having the cake that we made today. Yay!
With the isolation going on, I created my own Instagram page where I make all these drinks. It's called Mixing with Marrow. And I'm basically just sharing all my cocktails that I make.
This is how you wear this one. Just like this. This one is my favorite one. This is how you wear this one. Like this, you see it? That's it. Easy one, right? Hi, hope you enjoy it and be safe.
And staying safe is really what it's all about, keeping us all safe. And parents, I know, trust me, it is a pressure cooker these days, working and taking care of the kids at the same time. But as my 7-year-old said to me the other day, Mommy, this isn't forever. Dawna.
Aw, bless them. Thanks, Farah. Still ahead tonight, a helping hand, a warm word, and true patriot love as Canadians come together. And a reality check on this deadly pandemic from the World Health Organization. Stay with us. More lockdowns and restrictions are coming into force as countries try to limit the spread of COVID-19. In most countries, though, the curve is not flattening, and that includes the United States. Across the world, more than 16,000 people have now died, and the number of global cases has surpassed 375,000. China still tops the list of confirmed cases, but it's no longer the epicenter. Numbers are now rising the fastest in Italy, the United States, Spain, Germany, and France. With me now is Dr. Bruce Aylward. He is Senior Advisor to the Director General of the World Health Organization, and he is a Canadian. Few have seen this pandemic more up close than Dr. Aylward. Dr. Aylward, we last talked 18 days ago. You said then that the world was at a tipping point. Have we tipped?
Yes, indeed, Donna. As you've seen since we last spoke, the Director General of WHO has declared a pandemic, and that's a result of changes in what we know, or more, I guess, of what we know in terms of the severity of this disease, the scale of the disease, the societal disruption it can change, as well as the speed with which it can spread. And as you've seen today, we have over 300,000 people infected with this disease in over 185 countries now.
You know, Dr. Aylward, when we talked last, you told me the most critical thing for any government around the world is speed, to act fast, to plan for what's coming. When you look around the world now, do you think that warning was heeded?
I think people tried to, Donna. Countries realized that this virus was coming. They were seeing other countries being hit along the way. But frankly, very, very few, if any, countries were prepared for COVID-19.
We're hearing lots of talk about the possibility of a drug treatment out there. Even the President of the United States talks about it. Can you give us straight talk on where we're at with drug treatments and human clinical trials?
Well, the bottom line is right now we do not have a silver bullet. There is no proven antiviral that is going to work against COVID-19. There is, however, a huge amount of work going on to test the available antivirals that already exist, some which are still trial drugs, some are which drugs we've known for a long time, like chloroquine. But at this point, none of these proposed therapies have proven to be effective in randomized clinical trials. And without such trials, you just cannot be sure whether or not you're doing more good than harm when you treat people with these medicines.
You know, so many of us are now cocooned in our homes around the world, not interacting with other humans. How will we know when it's safe to emerge and resume normal life?
Well, hopefully you still are, first of all, interacting with other humans, Dawna, because, one of the tremendous things we've seen during this response is just, although people are cocooned in their homes, the extraordinary lengths they're going to interact with each other and to remain human. We are social animals, and it is such an important part of who we are. In terms of when we can emerge, what we really need to see is some of the heat coming out of this outbreak. You want to see two things. First, in terms of the outbreak itself, you want to see those case numbers coming down. You want to see a better understanding of what's really driving the outbreak and that the risks in those areas are being managed. And then on the other hand, you want to see sufficient capacities in the isolation capacity, the quarantine capacity, et cetera, to be able to manage any resurgent disease as it comes up. So it takes a few weeks at least to start seeing these measures have an impact. And again, that's a little window of time in which you've got to get those other measures in place to be able to manage, the person-to-person transmission, the new cases as they come up. So it's a tough balance right now. The public health and health authorities are trying to manage everywhere, including right there in Canada where you are.
Yeah, and there is pressure here in Canada for the government to act, to take stricter measures, to enact the Emergencies Act or use more of the quarantine powers. Is that kind of thing just inevitable in every country, that it has to happen, and maybe it has to happen now?
2 points on that. First of all, Dawna, nothing is inevitable. Remember, we're dealing with a biologic process here with infectious disease, and what we're seeing is it behave differently in different populations to a certain degree. We wonder how much of that is just time or how much of it is just the fact that some of this is unpredictable. But the trick with this virus, though, a little bit like you said at the end there, is this is a virus that once it does take off, it's going to move and increase exponentially. And your measures, your control measures, have got to be exponential as well to get in front of it. So small incremental measures won't work. And if there's a sense that you're losing control of these clusters, losing control of these transmission chains, you want to be moving very, very quickly in terms of measures that are going to really prevent people from interacting in a way that's going to just add more fuel to this particular fire.
All right. Dr. Bruce Aylward, thank you so much for taking the time with us. We appreciate it.
My pleasure.
After the break, the true north, strong and supportive. Global's Mike Drolet on our glowing hearts.
It's really disappointing that it's happening.
She's a tennis ace. Canada's Bianca Andreescu talks to Farah about our world, her plans, and canceling her ticket to Tokyo.
As the virus continues to spread, a Canadian member of the International Olympic Committee expects that the Games will be postponed. Team Canada has already said that it will not be sending its athletes if the Games were to be held this summer. Meanwhile, athletes from coast to coast have been training hard, like this familiar face. 6 months ago, we were all glued to our TVs as Bianca Andreescu became the first Canadian to win a Grand Slam singles title. Bianca Andreescu joins me now. Bianca, it's so great to hear your voice. When we last spoke, which was 6 months ago, you had talked about how excited you were about the Tokyo Olympics, and of course the world has changed so much since then. So what's your reaction?
Yeah, it's definitely disappointing. I was looking forward to playing the Olympics, and I'm sure every Canadian athlete that did have the opportunity to play is disappointed. But I understand that the health and safety for not only the players, but the fans and the citizens and the staff that are on duty, I think it's just first priority in anything is health. And it's really disappointing that it's happening during the time of the Olympics.
What advice do you have for people who are out there and day to day can't do the regular things that we love to do?
Right now, I'm self-quarantining myself. I can't practice like I usually do. I am doing fitness at home, though. I have a mini gym in my room, which is very convenient. I can stay as fit as I can during this time. Anything that you've learned about yourself or something unexpected that you found while in self-isolation with your parents? Yeah, so I used to play the guitar, and I still have my guitar, but I haven't picked it up in over 3 years. But now, since I have all this time on my hands, I started playing it again. A bit rusty, but who knows? Stay tuned for a video. But I want to ask you about young people, because there are a lot of young people who are getting a bad rap right now. We've seen some out, meeting with friends still. What message do you have for them? I have been seeing that on social media, but I think in this time it's really important to listen to our governments and the World Health Organization. This is a very serious issue. It's the health and the safety of other people, not only elderly people. You see so many other aged civilians that have been getting the virus and sadly have been fatal. So I really think that we can't take this as a joke. So we can just go on to our regular lives like it was before. All the best to you. We wish you the best of health, and all the best to your parents as well. Thanks so much for joining us. Thank you, Farah. Thank you for having me. Stay safe.
So there you go, Dawna, some wise words that we can all live by.
All right, Farah, thank you. We've seen Canadians in crisis come together before, though never in the face of a health crisis as widespread as this. As Mike Drolet explains, our strength is in each other, and this virus is uniting us, even from a distance, in ways we never expected.
It started as a simple offer to help isolated seniors from Calgary's Lakeview neighborhood get groceries.
And we got those apartment buildings up here too.
The Webb family printed up and delivered 2,500 flyers, and this weekend the orders started pouring in. The idea was to provide a lifeline to those in need. What it did was start a movement. The volunteers are now in the dozens, and they've come to understand it was never about groceries.
It's starting to get a real good feel of, you know what, nobody's alone here. Anything that happens, we're going to go through as a group, as a community. No one's going to get through this alone.
Isolation in this COVID-19 world has proven to be complicated. For every family like the Webbs, there are stories of people hoarding toilet paper or hand sanitizer or selling overpriced surgical masks on the sidewalk. Jerry Gitor and his staff at the Spirit of York Distillery in Toronto watched it all unfold and quickly retooled to make hand sanitizer.
The one thing I will say, it's probably the best ethanol you'll ever find in a hand sanitizer because we are a premium product.
They gave some for free and they sold some more to help the food bank. And like the Webb family, they found a purpose in doing so.
It was very important for us, not just to do something for the community, but also to rally our team. The team wanted purpose, they wanted to contribute, they wanted to do something.
The more this crisis drags on, hopefully others will feel the want to do something. In Ajax, Ontario, the Merhebs put supplies on the sidewalk outside their home. The food is for whoever needs it. The flowers for whoever needs to brighten up their day. A holistic approach to community she's instilling in her children.
I just want them to learn how to be compassionate to others, how to care for other humans. I'm all for love and caring for other people.
3 stories of selflessness in a time of isolation, a value that is proving to be contagious in a good way. Mike Drolet, Global News, Toronto.
This crisis can bring out the best in us. It's really up to us. This virus doesn't discriminate. It doesn't stop at any border. We're all in the same boat. If you think you're immune, you're not. If you think, even if I do get it, I won't get very sick, there's a chance that's true, but you can still spread it to someone who could get very sick and could die, maybe even a doctor or a nurse. If you're not worried about yourself, worry about others. The common good is as vital to us now as our own good. I'm Dawna Friesen. Thanks for watching and take care of yourselves.